Welcome to General Faculty and Preceptor Training on the Ascend Accredited Graduate Program in Nutrition and Dietetics. This overview module meets basic requirements for training as specified by Ascend, the Accreditation Council for Education in Nutrition and Dietetics. It is 45 minutes in length. There are additional follow-up training modules being developed with specifics relevant to supervised experiential learning in clinical, community, and food service management practice. This module has been submitted for approval for one CPEU through the Commission on Dietetic Registration. First, a note to preceptors. We are so glad you're here. We know that all you do benefits our students and future RDNs, and we think precepting can be a benefit to you as well. First, you get to pay it forward by helping train the next generation of RDNs for excellence in practice. You have the opportunity to provide input in program design and operations so we can continue to make it better. This also strengthens training for the next generation. It is possible to participate in student selection with some caveats. Because they are applying for a graduate program, it can be a little trickier for community partners to be part of the graduate school admissions process. However, if your involvement is specified in our affiliation agreement with you, and students are aware in advance of that role, it can be possible. You can earn CPEUs for participating in this orientation. You can also earn CPEUs, up to 3 per year, for a maximum of 15 for each 5-year cycle. A new benefit is that the department is able to sponsor preceptors who contribute substantially to the program in order to provide access to UT resources, including library subscriptions. Please reach out to the program director for details if interested. And lastly, of course, precepting provides the opportunity to build networks and vet potential future employees. Next, I'd like you to meet our core clinical team. My name is Melissa Hansen-Petrik. I've been a member of the UT faculty since 2001, and I've been the GP director since its inception in fall 2020. I teach mainly didactic and practicum clinical coursework on campus, coordinate courses involving clinical placements off campus, and oversee program operations. Stephanie Antonelli joined us in January 2024, coming from a site preceptor role with Meredith College in Raleigh, North Carolina. She is currently teaching nutrition assessment and nutrition counseling and education for us here on campus. Simulation is a particular passion of hers. Stephanie is the on-site faculty at the Cherokee Health System's Alcoa Clinic location. Jenna Martin has been with us since August 2021, coming to us via the University of Memphis, where she built a foundation in clinical pediatrics, and from NHC here in Knoxville, where she developed skills in management and long-term care. She is our pediatric specialist and is the on-site faculty at the Cherokee Health System's Cherokee Mills Clinic location. On campus, she teaches the nutrition assessment practicum and professional issues in nutrition and dietetics. Two other very important members of our team are Marcia Spence and Kimberly Johnson. Marcia teaches all the graduate level community nutrition courses in the program. This includes a 4-week community nutrition practicum during the summer months and a fall-spring course sequence spanning from community nutrition assessment to community nutrition implementation and evaluation. Kim has taken the lead role in all of the department's management courses, coordinating all aspects of the introductory food service management practicum on campus with Vol Dining, teaching a didactic management course, and coordinating the culminating management practicum experience with local hospitals and other facilities. Many other departmental faculty play important supporting roles along the way as well. You can learn more about our faculty and programs on our website at cehhs.utk.edu/nutrition. So now to the objectives of this training. First, I'll provide an overview of graduate programs in nutrition and dietetics as a whole. Then I'll introduce you more to the GP here at the University of Tennessee. Specifically, I will familiarize preceptors and faculty with the level of training and experience students have prior to entering the practice setting, so everyone knows what to expect as a baseline. I will also familiarize faculty and preceptors with expectations of what students need to accomplish while in the practice setting. The last objective is to assure that preceptors and faculty are prepared to fulfill the expectations of their roles by participating in this and other trainings, identifying supporting resources, and providing for ongoing support. Let's begin with an introduction to the salient features of the GP model as a whole. One of the most important features is that didactic learning is integrated with supervised experiential learning throughout the curriculum. Compared to the traditional model where students complete all their didactic coursework and then transition to the practice setting, students in the GP learn in the classroom and practice the skills simultaneously to enhance learning. GPs also employ competency-based education. We will explore that later in this orientation, but it mainly means that students build towards achieving competency for entry-level practice in a stepwise fashion, and they must provide evidence of each required competency for their final portfolio. Programs must culminate in the minimum of a master's degree, and programs must provide a minimum 1,000 hours of experiential learning at the graduate level. The movement toward GPs has been relatively rapid. As of 2024, there are over 100 GPs accredited or in the process of attaining accreditation in the U.S. Prerequisites vary widely among programs. Some require completion of a didactic program in dietetics or DPD. Most require completion of specific prerequisites, sciences, lower-level nutrition courses, etc., but students can come from a variety of degree backgrounds. While all GPs result in a graduate degree, they can have varying areas of emphasis, i.e., clinical practice, community nutrition, general dietetics, etc. This rise in GPs has coincided with a decline in students applying to dietetic internships. Tennessee is home to 3 GPs, all in East Tennessee. The program here at UTK builds upon a foundation of prerequisite coursework and is accredited for up to 20 students per cohort. Our master's concentration is in clinical nutrition and dietetics. UT Chattanooga has a 2-year in-person program culminating in an MPH degree. And Tennessee Tech has a 22-month program leading to an online master's in community health and nutrition and includes 12 months of concurrent in-person supervised practice. So, about us. The GP at UT Knoxville was first accredited in September 2020 after 3.5 years of planning and preparation. It has replaced the combined master's degree dietetic internship program, so we no longer have dietetic interns. All of our students are graduate students in clinical nutrition and dietetics. Our program is designed primarily within an accelerated combined bachelor's-master's degree model. This means that incoming freshmen have the potential to complete both degree programs in 5 years. The accredited GP comprises the last 2 years as students begin graduate coursework in year 4. For fall 2025, we do have the ability to accept external applicants to the 2-year program if they have met program prerequisites. As already noted, the degree earned is a MS in Nutrition with a concentration in clinical nutrition and dietetics. Graduates are eligible to take the RDN credentialing exam, and we graduated our first cohort in May of 2022. The mission, goals, and objectives of the program really drive our direction, so I'd like to begin there. The mission statement is a bit lengthy, but encompasses who we are as a program. 2 of the first components are simply inherent to GPs. We integrate didactic and experiential learning, and the program culminates in a graduate degree. Beyond that, our mission entails effectively preparing graduates for evidence-based nutrition and dietetics practice, practice-based research, and professional mentorship and leadership as RDNs in an interprofessional healthcare environment, with the purpose of optimizing the nutritional health of individuals, families, and communities. Our goals are directly born from the mission statement, and they are threefold. Program goal number 1, graduates will be prepared for effective, evidence-based clinical nutrition and dietetics practice as credentialed, registered dietitian nutritionists. Goal number 2, graduates will be prepared to be effective members of an interprofessional healthcare team. And goal number 3, graduates will be prepared for mentoring and leadership roles in nutrition and dietetics. Under each goal is a set of objectives. The objectives aligned with goal number 1 are ones that are required by Ascend, with objective 3 being one of our choosing that addresses employer evaluation of graduates. Our program completion rate is high, with just one student opting to seek employment after the bachelor's degree and thereby discontinuing program enrollment. Graduates have been highly employable, with 100% of those seeking employment being employed in nutrition and dietetics within 12 months. For the employer survey, we chose to ask employers about agreement with a statement that program graduates were ready and functioned independently in their jobs faster compared to other employees hired to the same position, and most agreed. All but one graduate took the RDN credentialing exam within 12 months of program completion, and thus far 100% have passed the credentialing exam within 1 year of first attempt, which is the measure required by Ascend. Some of them did take it more than once in order to meet that target. As we were just talking about employment outcomes, it may be helpful to see what it is our graduates from the first 2 cohorts are doing. As a clinically focused program, it perhaps isn't surprising that most are employed in clinical practice areas: 9 in general acute care, 3 in neonatal intensive care, 3 in long-term care, and others in metabolic support, transplant, dialysis, oncology, and rehab. We also have 1 traveler, 1 weight management counselor, and 1 practicing in community nutrition. 1 is a clinical nutrition manager, and 3 are credentialed as certified nutrition support clinicians. While most have remained in the Knoxville area, 7 have ventured west of the Mississippi, with 1 in Alaska. A couple are in Washington, D.C., and 1 in Massachusetts. Otherwise, graduates so far are concentrated in Tennessee and surrounding states. Our second goal is that graduates will be prepared to be effective members of an interprofessional healthcare team. We are evaluating this using the Interprofessional Socialization and Valuing Scale, which utilizes 9 questions and a 7-point Likert scale. It is validated to evaluate interprofessional beliefs, behavior, and attitudes in both healthcare practitioners and healthcare students. Our sample size is small so far, but students have rated highly on the scale overall. You'll see 4 of the questions here for illustration. I feel comfortable in speaking out within the team when others are not keeping the best interests of the client in mind. I believe that the best decisions are made when members openly share their views and ideas. I feel comfortable in describing my professional role to another team member, and I have gained an appreciation for the importance of having the client and family as members of a team. Where the students rated slightly lower is in the behavior questions, such as feeling comfortable speaking out and feeling comfortable in my describing my professional role. So preliminary findings bear watching and also suggest providing modeling and support to students in interacting with other healthcare professionals may be helpful. The mentoring aspect of our program is one that has been working well so far, with students in the final term of the program mentoring students who are 1 year behind them in the clinic setting. Early survey data show that 100% of graduates who responded agreed or strongly agreed that the program prepared them well for mentoring and precepting others in the practice setting. Data on mentoring and leadership roles will begin to be collected in summer 2025, 3 years after the first cohort graduated. Next, I'd like to step into competency-based learning, which is another foundational aspect of our program and of all GPs. The GP here at UT employs competency-based learning, as is inherent with the GP model. So the question comes up, of course, what is competency? And the answer is a simple one: having the knowledge, skill, and judgment required for entry-level practice. The Ascend approach to competency-based learning is built upon the Miller's Pyramid model, which grows competent learners from novice to expert by building first a foundation of knowledge and progressively layering upon that the ability to show how to perform a skill, and ultimately the ability to perform a skill. Knowledge is generally tested through written quizzes and exams in a multiple choice, short answer, or similar format. A more complex level of knowledge may be demonstrated through case-based exams and essay format, applied practice questions on exams and on assignments. Shows level learning happens through completion of case studies and role-play simulations that prepare students for the practice environment. One key example here is the Objective Structured Clinical Exam, or OSCE, where a student is tested on specific clinical skills in a structured simulation setting. Finally, students reach the DOES level for a skill, where they are performing it in the practice setting. While the KNOWS level provides the foundation, integrating KNOWS, SHOWS, and DOES components within the curriculum provides the opportunity for students to apply information as they're learning it to enhance overall learning and achievement of practice competency. This background information is important for you to understand because, as you'll see shortly, all the Ascend competencies and their associated performance indicators have a requirement as to the level at which they must be met. Let's start by looking at an overview of the standards with the 7 unit areas into which competencies are classified. The current GP standards were most recently revised in 2022 and are updated every 5 years, so the next ones will likely be released in 2026 and go into effect in 2027. The 7 unit areas in the current standards are foundational knowledge, client and patient services, food systems management, community and population health nutrition, leadership, business management and organization, critical thinking, research and evidence-informed practice, and finally Unit 7, core professional behaviors. Now within these 7 units, there are 37 required competencies, and within the competencies, a total of 221 performance indicators, or PIs, that must be met somewhere within the curriculum and accessible so that they may be used to demonstrate competency achievement. Each PI is classified by the minimum level at which it must be met: knows, shows, or does. From these 7 units, I'd like to highlight 2 of them just for illustrative purposes. One is Unit 2, Client and Patient Services, which includes a lot of really heavy-hitting competencies and PIs. So Unit 2 focuses on application and integration of client and patient-centered principles and competent nutrition and dietetics practice to ensure positive outcomes. So you'll notice a couple of the competencies within this are 2.3, which addresses the nutrition care process and includes 27 specific performance indicators, and also implementation and coordination of nutritional interventions for individuals, groups, or populations, which includes 19 PIs. And 2.5, we're going to look at a little bit more closely, and that has to do with nutrition-related pharmacotherapy, within which you'll find 10 performance indicators. Now, as I just mentioned, competency 2.5 related to nutrition-related pharmacotherapy includes 10 performance indicators. I've just put the first 5 up on the screen here to show you what's included, But one thing that you will notice here in particular is that this competency must be met at the shows level, and all the performance indicators also are at the shows level, as many times students will not be in a position to be working with a registered dietitian who is prescribing, recommending, and administering nutrition-related drug therapy. So this is something that we happen to address within the simulation setting. Unit 6 is critical thinking, research, and evidence-informed practice, meaning that through this unit, students will integrate evidence-informed practice, research principles, and critical thinking into practice. There are 3 competencies within this unit, and you'll see the number of performance indicators for each indicated in the parentheses following the competency. Now we're going to highlight competency 6.2 here. Applies scientific methods utilizing ethical research practices when reviewing, evaluating, and conducting research. Now, what you will notice about this competency and all the associated performance indicators is that they are all required to be met at the does level. So that includes identifying, explaining, and applying the steps of the scientific method and processes, articulating a clear research question or problem and formulating a hypothesis, identifying and demonstrating appropriate research methods, applying research ethics and responsible conduct in research, collecting and retrieving data using a variety of methods, qualitative, quantitative, etc., and technologies, analyzing research data using appropriate data analysis techniques, qualitative, quantitative, and mixed, also at the does level, and translating and communicating research findings and conclusions through a variety of media. Here I'm sharing with you one page of our curriculum map for illustrative purposes. So this really shows how all the parts fit together to meet accreditation requirements. So if you look across the top, whether or not you can see this, I will orient you to it, but prerequisite courses, semester or term 1, term 2, term 3, term 4, and term 5. And under each of those, each column represents a specific course. And then in the far left column, everything is color coded, blue for knows, yellow for shows, and green for does. And so each of these is a competency. And then in the second column, each of the performance indicators that fall within that competency, and each of those are color-coded. So you will notice that most of them are green, indicating that they must be met at least the does level. There are a handful of blue ones that must be met at the knows level, and some that are at the shows level. So as we go across from prerequisites and through the terms, you'll see in general more green or more does level competencies later on in the curriculum, whereas early in the curriculum is where some of the knows are appearing, okay? And then some shows. So where you see a predominance of shows here relates to the nutrition-related pharmacotherapy competency. So hopefully that gives you a little bit of an idea about how all this fits together. You don't need to know all of these details, but just for a general understanding. Now that you've got some nuts and bolts terminology, let's talk about what happens within the program. It all begins with our students. One of the things I've loved about each cohort is that they grow together and become a truly excellent support system for each other as they move through the program. Here you see our 2023-2025 cohort number 4. There are 18 of them, and this is our largest group yet. 10 are from Tennessee, and 1 each from Kentucky, Massachusetts, Michigan, New Jersey, New York, 2 from Ohio, and 1 from Pennsylvania. 4 of them earned an associate's degree at Pellissippi State before transferring to UT, and 2 others came to us with bachelor's degrees already, 1 in sociology and 1 with a double major in public health and Spanish. Our newest cohort is cohort 5, who will complete their master's degrees in 2026. This group of 15 students is made up mostly of Tennessee natives, plus 1 student from Arkansas and 1 from Virginia. 4 of them earned an associate's degree before arriving at UT, with those degrees coming from Pellissippi State, Roane State, and Walters State universities. While our curriculum is well packed, a few of them have been able to make room for minors in areas such as child and family studies, culinary arts, psychology, and public health. It is helpful to know how students enter the program and what the curriculum looks like, so you'll have an idea of how their education progresses and what it includes. We'll begin at the beginning with program entry. Students may enter the program through our undergraduate nutrition major and a concentration in dietetics. This route is the most common. Students may also begin in community college or at another university, or even complete a bachelor's degree elsewhere first. For the community college route, students are most often completing an associate's degree in nutrition at Pellissippi State Community College before transferring to UTK through the Tennessee transfer pathway. Regardless of route, there are commonalities in preparation. In addition to general education requirements, students also complete numerous science prerequisites, as well as beginning and intermediate coursework in nutrition and related areas. This coursework includes General Chemistry 1 and 2, Organic Chemistry, Biochemistry, Human Physiology, Microbiology, Introductory Nutrition, Lifespan Nutrition, Micronutrient and Macronutrient Metabolism, Nutrition Assessment, Food Science or Culinary Arts, a Physical Activity-focused course, Medical Terminology, Public Health, and Introductory Research Methods. As previously mentioned, beginning with Fall 2025 entry, we also have the ability to accept external applicants with a DPD or prerequisites directly into the graduate program. Once admitted to the program, students have a 2-year curriculum that comprises the GP. Terms 1 and 2 align with fall and spring semesters of the senior year. Courses shown in bold, Nutrition 425, 430, and 506, are taken for graduate credit. Nutrition 415 and/or 416 may be taken for graduate credit as well. Terms 3, 4, and 5 include summer, fall, and spring semesters, and these are fully at the graduate level. Overall, there is an integration of didactic coursework and supervised experiential learning in clinical, food service, and community nutrition, which we'll explore next. We'll focus first on clinical dietetics, which comprises the major part of the overall program. Foundational prerequisites for clinical practice are built into the junior year. These include nutrition assessment and nutrition assessment practicum, which familiarize students with the nutrition care process and how to use an educational electronic health record or EHR platform. They practice anthropometric measurements in infants, children, and adults, practice interviewing skills, including dietary intake assessment, learn and practice the nutrition-focused physical exam, and learn to measure blood pressure. They then enter Term 1 of the GP, which aligns with senior year. During this term, didactic coursework includes Clinical Nutrition 1, where students learn about pathophysiology and evidence-based guidelines for medical nutrition therapy in obesity and weight management in adults and pediatrics, disordered eating, diabetes, cardiovascular disease, and cancer. It also includes nutrition education and counseling, where students practice communication skills, including counseling and education for various audiences, with an emphasis on building skills in motivational interviewing. Simultaneously, students are enrolled in the Clinical Nutrition 1 practicum, where they build upon the nutrition assessment practicum and meld what they've been learning about motivational interviewing and chronic disease interventions into case-based and simulation practice with peers and with standardized patients. This is an example of how didactic learning and supervised experiential learning are interwoven to enhance the learning of skills students can take with them into the practice setting. One of the terms I just mentioned that you may or may not already be familiar with is standardized patient. While role-play practice with peers can provide valuable preparation for the clinical practice setting, More true-to-life experiences can provide a heightened level of realism. That is where the standardized patients come in. Standardized patients, or SPs, are trained to be specific patients. They memorize a profile and play the part to provide a more realistic patient encounter. In our program, we use SPs for anthropometric assessment, nutrition-focused physical exam practice, nutrition interview practice, and nutrition education and counseling application, utilizing motivational interviewing skills and medical nutrition therapy knowledge related to chronic disease conditions. This photo shows one of our students in a counseling session with a standardized patient. The student begins with review of a realistic electronic health record, or EHR, built into an educational EHR platform. This includes medical history, lab work, medications, referral information, etc., which provides the student with enough information to prepare to meet the patient. Guided pre-briefing helps students to think through their session plan, participate in the session, and finally to debrief what took place. In other words, talk through what went well and areas in which they can continue to grow and modify their approach to become more effective educators and counselors. The ongoing rounds of pre-briefing, leading sessions, debriefing, and reflecting are key to continuous growth. The students also complete documentation for the EHR following completion of each session. Within the Clinical Nutrition 1 practicum, we also integrate enrichment experiences where possible. One activity we have included over the past few years is an interprofessional simulation with the College of Nursing, where nursing and nutrition students work together to review a patient's health record and then see a standardized patient together to navigate the roles of both nutrition and nursing and learn from each other to provide optimal patient care. Another valuable enrichment session that has been included focuses on diabetes management, where students learn to interpret continuous glucose monitor readings, check their blood glucose, and dose insulin, among other diabetes-related activities, all of which aim to build critical thinking skills related to dietetics practice. In Term 2, students continue didactic learning in Nutrition 416, where they build their knowledge base in additional areas, such as gastrointestinal diseases and disorders, pancreatic and liver disease, kidney disease, pulmonary disease, and introductory nutrition support. Within Nutrition 506, the Clinical Nutrition 2 practicum, we include elements of both simulation and professional practice. The course commences with primary care boot camp that prepares students for success, specifically in the primary care setting. Then, at the close of the semester, students participate in an acute care boot camp that escalates their readiness to enter into acute care in the summer. Sandwiched in between, they build upon their Term 1 simulation experience and primary care boot camp through 6 full days over the course of 6 weeks in a Cherokee Health Systems clinic, where they see patients under the guidance of a faculty member and a graduate student mentor. I will call this their novice level experience in primary care. Students in the CHS clinic see patients both in person and via telehealth. Telehealth appointments occur primarily via phone. As the program's first semester in clinic was spring 2021, all appointments were initially by phone. By 2023, students were seeing more patients in person. In summer 2024, 18 students had a total of 172 patient encounters in 2 separate clinics. Patient populations vary by clinic, with the Alcoa site seeing more adults and the Cherokee Mills site seeing more children and families. Now, as we continue the clinical progression into Term 3, or the summer term, students continue their time in clinic, another 4 to 5 days in clinic, where they are at an intermediate level, continuing to build proficiency in medical nutrition therapy counseling, still under close supervision, with lots of pre-briefing, debriefing, and skill development with their faculty supervisor. At the same time, they're beginning their acute care experience, so that builds upon everything that has come before. And they have approximately 20 days in Introduction to Acute Care, where they learn all aspects of the nutrition care process within the acute care setting, also as part of Nutrition 516. As they move into the fall semester, they have one additional didactic course that focuses on critical care, developmental disabilities, and inborn errors of metabolism, so some more advanced content areas. And at the same time, they are continuing in clinic, where they are moving into advanced level with an additional 6 days, where they're building more proficiency and independence in their counseling to prepare them for their final term. At the same time, they are moving from general introduction to acute care into more advanced acute care over the course of the fall and spring semesters. So they explore additional clinical elective areas, including critical care and metabolic support, advanced general clinical or staff relief, pediatrics, endocrinology, oncology, bariatrics, dialysis, disordered eating, etc. So they have a number of different areas that they can explore according to their interests and also availability of placements. During this time, we also integrate any additional simulation where possible. We are working currently on implementing a new interprofessional education, pediatric feeding and swallowing simulation in combination with students in occupational therapy and speech-language pathology. During their final term, term 5, the students continue for an additional 5 to 6 days in clinic, and at this point they are ready to play a major role in orienting and mentoring new students in clinic through their sessions, debriefing, and charting guidance. So in all, students have accumulated at this point approximately 700 hours of supervised experiential learning in clinical practice, most of them being at the graduate level. To summarize the overall supervised experiential learning, or SEL, hour breakdown, specifically within the clinical realm, students have about 100 hours in role play, case studies, and simulation, approximately 180 in Cherokee Health Systems clinics, 150 to 160 in general acute care, and about 260 supervised experiential learning hours in clinical electives, for a total of approximately 700 supervised experiential learning hours. As we continue, we'll look at what that time looks like within community nutrition, food service management, and research. The community nutrition knowledge, skills, and practice progression begins with students enrolling in an introductory community nutrition course in the fall, or term 1. This course includes exploring cultural foodways, programs, and policy, and also includes the option to enroll in an elective service learning course where students can experience 20 hours in the community nutrition setting. During term 3, our students enroll in a community nutrition practicum where they spend 4 weeks, 4 days per week, in a community nutrition site, either Beardsley Farm, Nourish Knoxville, Second Harvest, or UT Extension have been the sites in recent years. During terms 4 and 5, students enroll in a series of both didactic and practicum community nutrition courses. Community Nutrition Assessment, or Nutrition 503, focuses on community nutrition assessment and also has an associated practicum in conjunction with the Knox County Health Department. During their final semester, their didactic course focuses on community nutrition implementation and evaluation. They do develop a nutrition grant proposal during that time and continue on with their practicum experience with the Knox County Health Department. In total, students accrue approximately 220 supervised experiential learning hours in community nutrition. Here you see a few of our students in the 2025 cohort enjoying their time in their community nutrition practicum in summer of 2024 with Nourish Knoxville and at Beardsley Farm respectively. The food service management, knowledge, skills, and practice progression begins in Term 1 with food service operations management, offered by Hotel and Tourism Management, HTM 210. Concurrent with this course, students are enrolled in a food service management practicum that is offered by the Department of Nutrition in conjunction with Aramark here on campus. In this experience, students learn all aspects of a large-scale food service management operation through hands-on experience with ball dining. What they build upon this in the following term is in the didactic setting, Nutrition and Dietetics Management, Nutrition 403, where they cover all aspects of leadership, human resources, financial planning, strategic management, etc. And at the same time, they are also enrolled in restaurant and catering management and execution, which is an excellent hands-on experience as part of the Ready for the World Cafe. Students are involved in all aspects of planning a themed catered event. They actually have 5 luncheons during the semester and 2 food trucks. So they get a lot of practical experience in that setting. Their next food service management experience takes place in Term 5, which is entitled Healthcare Food Service Management or Nutrition 530, where students attain experiential learning in healthcare food service or school nutrition, addressing higher level management competencies. So in all, students accrue approximately 230 hours in the management setting, a majority of those at the graduate level. Here you see a couple of photos of students engaging in the HTM 445 course. You see a place setting on the left from the Ready for the World Cafe catered event, one of them from a recent semester. And on the right, you see several of our students in the Food for Vols food truck. We rely on a number of partners to prepare our graduates for top-notch practice post-graduation. I've listed current partners here. If you are listed here, thank you. We couldn't do this without you. If you are not listed here yet, but are considering taking on a role preparing the dietitians of the future, we are always looking for new partnership opportunities. The final area I wish to touch on is research. Students do have a prerequisite of a research methods course, and during the program, progressively develop applied research skills. We do hope to grow and expand this program component. So far, students have participated in practical projects such as systematic review development and research survey development and implementation. The total supervised experiential learning hours from research amount to about 40 hours throughout the program. They've done really well in this endeavor and were able to present posters at the annual Tennessee Academy of Nutrition and Dietetics Conference in 2024. One of their posters even took first place with their survey of the ongoing practice of using gastric residual volumes in enterally fed patients. From a big picture perspective, the GP at UT Knoxville is a 2-year program. Students primarily begin in the bachelor's degree program as nutrition and dietetics majors, but as you've heard, we have the ability to accept external applicants beginning in the coming year. Students progressively grow through the knows, shows, and does levels of Miller's Pyramid as they build competency through activities such as simulations and case studies. Students apply at the end of their junior year to the GP. We are accredited for a maximum of 20 students dependent upon placement availability. And during this time, students can earn a bachelor's and master's degrees both in 5 years. Some graduate coursework begins during senior year, which is the first year included in the accredited GP. Students are classified as graduate students in clinical nutrition and dietetics, and the Master of Science in Nutrition degree that they earn is with a concentration in clinical nutrition and dietetics. The faculty include Melissa Hansen-Petrik, that's me, who directs the program and teaches dietetics coursework, Stephanie Antonelli and Jenna Martin, who provide direct supervision in Cherokee Health Systems clinics and teach applied coursework here on campus, Marcia Spence teaches graduate level community nutrition coursework. Kim Johnson teaches food service and management related coursework within the department. And we look forward to filling 2 vacant clinical faculty positions within the coming year. You can find more about our program on our website at cehhs.utk.edu/nutrition or by scanning the QR code on the screen. We're also available on Instagram. Next steps for preceptors include completion of site-specific training once this becomes available. There will be separate specific training for clinical practice, community practice, and healthcare food service management sites. For both faculty and preceptors, you may access training and resources on recognizing bias in self and others to reduce microaggression and discrimination. This is optional and available on the department's preceptor page. For both faculty and preceptors, I ask that you complete the online training survey. Preceptors must upload a resume or CV, and once we have CDR approval, the CPEU certificate will be available upon survey completion. Thank you very much for your time. I hope that you'll reach out if you have any questions.